Cam is a Vietnamese, Laotian, and French woman with a small physique. She welcomes all people, race, gender, or issue. If someone is willing to attend, Cam is willing to help. The group was definitely a mix. Dr. Bishu was not sure what to expect during the course of the healing and was a spectator at first. He saw how the ceremony opened with introductions and intentions. Everybody was willing to share. When the medicine circle started, he could feel an energetic field throughout the room, which put him in the mood to dance. The circle was formed, and the first person of about 20 entered the circle. Cam worked with the dancer, and the other people in the circle joined in intuitively to help. The dancer had cried and screamed out the emotional distress that was buried inside. Once the dancer was calm and back to herself, Cam smudged the energy out of the room. Then the circle was ready for the next dance. One after the other, the circle was active with dancers releasing the energy and pain they were holding in for many years. There was no judging. Everybody was supportive of the others. Even Dr. Bishu participated as his intuition took hold of him. He noticed the difference in people's expressions and the lightness that people were carrying around them. He knew there was a difference in the people from when they arrived and when they left, but nothing he could see was tangible. There was nothing he could take back and study. He did notice the sense of bonding that occurred and had some good conversations during the lunch break. He was impressed with the conscientious diets the participants had, organic, mostly vegetarian, and little dairy. Medical school never taught nutrition or how the emotions affect the physical body, only the scientific way to pursue it. He thought about another patient with serious digestion issues, Dominic Tasker. Hungry for more information, he spoke to Cam and asked about the process. Cam explained how working intuitively with rattles, feathers, and drums helps her to help the dancer. She is able to work with their body to work out any issues that come up. She works through movement and expressions and follows as she is guided. Cam stays with the dancer until their demeanor changes and she knows the transition has taken place. People who have experienced the transition may take a few weeks to adjust, so she leaves herself available for guidance. Dr. Bishu was impressed with the process. No insurance, no medications, and the support of the circle of dancers made the dancer feel safe to feel vulnerable. Incredible. When he was ready for his dance in the circle, a childhood memory came up that touched his core. It was the memory of when his brother was diagnosed with a heart defect and did not survive it. He remembered the pain, and the same pain he felt as when he had to tell one of his patients their illness was terminal, or how his hands were tied due to the red tape from insurance companies. He had become a pro at burying the feelings as soon as he felt it, and dancing in the circle brought it all to the surface. He could not bury it any longer. It was ready to erupt. He remembered yelling and pounding the wall, and even challenging Cam as they wrestled around for control. He found himself pinned down by the smaller woman, half his size, as he gave in to the pain. He cried for his brother and all the patients that he could not help. He had felt the support of the other dancers in the circle, the drumming and rattles, and realized it was important for him to let go. He was surprised at how fast it worked and how Cam was able to take on someone his size. It was very clear to him that something had definitely shifted in his psyche. During the next couple weeks that followed, he went through a period of high and low emotions. He was not feeling quite like himself. After this passed, he noticed how lighter he felt inside. The issue that was buried for a long time was accessible and not as painful. He was able to feel it and know it is there, but then let it go without guilt. He saw the benefits of the medicine circle and wondered how Cam monitors the dancers' progress. He spoke to Cam about this, and she said she sees people's smiles every week as they dance, or they tell her they are feeling good and have many positive changes in their lives. Dr. Bishu was not quite as convinced that this was the best way to monitor. He is more comfortable with tests, x-rays, and MRIs, more tangible ways. Dr. Bishu also remembered Officer McCullum had mentioned biofeedback. He decided to look into what this was about and exactly how it worked. He went to a class on how to use biofeedback to get a reading on the person's health. He was impressed with the accuracy of the machines diagnosing illnesses and disease that a doctor could not find doing a regular exam. He felt it was important to continue with the classes. With all the knowledge of medicine, the biofeedback machine, and learning about nutrition, Dr. Bishu had become a multifunctional doctor. He has access to x-rays, labs for blood work, and when there is something emotional, he can direct his patients to Cam for a dance. He has received many positive responses from his patients and continues to dance himself. He has earned the reputation of being the dancing doctor, a title he wears proudly.